I'm washing my hands. Okay, knock. Hi there.
Hi.
How are you doing?
I'm good. How are you?
I'm good. My name is Rajana. I'm going to be a nurse practitioner today, and I'm here to do your physical exam. Is that okay?
Yep.
Okay, can you tell me your full name and date of birth?
Rebecca Johnson, May 18th, 1992.
Okay, perfect. Can you tell me where you are here, where you are, and why you are here?
I'm at George Mason University for my physical exam.
Perfect. And can you tell me the date and what year and time it is?
It is March 22nd, 2021, and it is 1 p.m.
Perfect. So I'm just doing a general survey. Patient is alert and oriented ×4. She is sitting upright, pretty comfortable. She is appropriately dressed for the climate. She looks clean and well groomed. She is making a good eye contact with me, and her speech is very clear. She does not look in any distress or any. Do you have any pain?
No.
Okay. She does not have any pain. Her body looks symmetrical bilaterally, and everything looks normal. So that's your general survey. I'm going into the skin, just inspecting your skin. Before that, I want to ask you just a few questions. Do you have any history of skin infections or any eczema?
Nope.
Okay. Do you have any hyperpigmentation of the skin?
Nope.
Okay. That's good. So looking at your skin, there is no hyperpigmentation right now. There's no any mass or lesions or any scars, any bruising, anything like that in the skin. So that's good. I'm just gonna palpate your skin, okay? Okay, it looks warm, nice. No any swelling, no any tenderness, any pain?
Nope.
Okay. Just checking a skin turgor, and it goes back right away. So there's no any signs of dehydration. That is what is expected. So that's normal. That's very good. Okay, moving on to your HENT, which is a head, ear, eyes, nose, and throat. Okay, starting from your head, I'm just inspecting your head. There's no any abnormal mass, any overgrowth of the skull bone, or any lesions or anything like that in the head. Okay, I'm just gonna palpate.
Okay.
Okay, I mean, again, I don't feel any masses or lesions or scars. I don't see any scars. The hair is good texture, evenly distributed equally. There's no any parasites or any infestations that I can see. The scalp was pretty easily movable, and there's no any skull depression or anything like that, so that's normal. Okay, moving on to your face. With the HENT, I'm just gonna ask you a question.
Okay.
Do you have any problem with vision or hearing?
Nope.
Do you have any abnormal drainage from your nose or ear?
Nope.
Okay, perfect. So moving on to your face. Okay, I want you to smile, puff out your cheeks, and frown for me. Okay, so that was checking the cranial nerve 7, and that's intact. I'm just gonna touch your face. Do you mind closing your eyes? Okay, let me know what I'm touching.
My face, or my forehead, my cheek, and my chin.
Okay, perfect. So she was able to feel it with no any problem. So that's our cranial nerve 5, and that's intact. Okay, look, going on to your Tmj joint. I'm just gonna feel it. So looking at the Tmj joint, I don't see any redness or any abnormal mass or growth of the bone. Okay, any pain?
Nope.
Any tenderness?
Nope.
Okay, open your mouth, clench your teeth for me. Okay, any pain when doing that? Okay, open your mouth, close, move on side to side. Okay, open your mouth. Okay. Close your mouth, don't let me open. Okay, so range of motion, our Tmj joint, temporomandibular joint is intact. That was checking the cranial nerve, again 5, and that's intact. Range of motion is normal, and the strength is 5 out of 5 for Tmj joint, so everything looks good, okay? Looking at the temporal artery, there's no any redness or any pulsation that I can see. I'm just gonna palpate. No any pain or any pain?
Nope.
Okay, no tenderness also. There's no any signs of temporal arteritis, which is normal. So moving on to your eyes, looking at your eyes, inspecting, there's no any swelling of the eyelids, there's no any inflammation of the lacrimal apparatus, the eyebrows are pretty symmetrical, hair distribution is normal. Just gonna look at your conjunctiva, it's pink, which is expected, no any exudates or any discharge or anything in the eyes, okay? So next is, I'm gonna do the pupillary reaction. I just want you to look straight. And I'm going to shine the light on this eye. Okay, so I was able to hear, look at the pupil constriction on this eye, so which is a direct response. And I'm doing the same thing. I'm going to look at the other eye. Okay, I was able to see the pupil constriction in the other eye, so that was the consensual response, and that's normal too. Okay, I want you to look into this pain and just focus on Okay, her conversions and the accommodations are normal. I want you to, so checking for the extraocular muscles, that's cranial nerve 3, 4, and 6. I want you to follow this pen. Just looking at the lateral movement, any abnormal deviations of the eye. Okay, her extraocular movement of the eye, that's normal, and so that says that cranial nerve 3, 4, and 6 are intact. Okay, next is the cover-uncover test. So can you look straight? So looking straight, there's no any abnormal deviation, no any lateral movement of the eyes. Okay, so can you cover one eye? Okay, again, there's no any abnormal deviation or any movement of the eye. Uncover the eye. Okay, can you do the same thing? Again, there's no any abnormal movement or deviation, and again, there's no any abnormal movement deviation. So cover-uncover test is normal. Next is the just checking the peripheral vision. Okay, so I want you to look straight and just let me know when you can see my finger.
I can see him.
Okay,
I can see him.
okay, that was checking the peripheral vision, and that's normal, so it was good. Moving on to your ear. I'm just looking at inspecting your ear. The wiggle test that I did, that's called the visual field by confrontation. Okay, moving on to your ear, I'm looking at the pinna, tragus, and the mastoid process. Everything looks normal. There's no any mastoid bone growth or any redness or any abnormal mass or lesions in the ear. I'm just gonna pulp it. Okay, any pain? Okay, no pain, no tenderness. Again, no any swellings in the ear. I'm just gonna do the whisper test. Go ahead and cover the other ear. So, oh, this ear, I'm sorry. Go ahead and cover this ear and just let me know what you can hear, okay?
Apple pie.
Perfect. And I'm gonna do the same thing here.
Soccer ball.
Okay, perfect. So she was able to hear with no any problems, so her cranial nerve 8 is intact. Okay, and with the ear, the next thing I'm going to do is your hearing test to check for any unilateral hearing loss with the tuning fork. I'm just going to vibrate and put it in your on the top of your head, and you let me know if you can feel the vibration in the ears. Okay. Can you feel it? Okay. Is it equal in both ears?
Yep.
Let me know when it stops.
It stopped.
Okay, so so it was equal in the both ears. Okay, so that tells us that the Weber test is negative. If if you hear the vibration on one ear and not on the other ear, that will tell us that the Weber test is negative and the unilateral hearing loss is there. The next is the Rinne test. So for Rinne test, I'm gonna put the vibration tuning fork in the mastoid process. Okay. So I'm gonna do it in this ear. Okay. Can you feel the vibration? Okay, let me know when to stop.
Stopped.
Okay, can you still feel it? Let me know when to stop.
Okay, I can't hear it anymore.
Okay, so which was the, where did you hear it louder, in the side of the ear or the mastoid bone?
The side of the ear.
Okay, so that tells us that ear conduction is greater than the bone conduction, which is expected. It's usually 2:1, and that is Rinne test positive, so there's no any signs of unilateral hearing loss. If Rinne test is negative, then she would have here the bone conduction is greater than the ear conduction, and that's the unilateral hearing loss. And you would do the same thing on the other ear. Okay, moving on, I'm gonna do the test with the otoscope. Okay, so I'm gonna go into this ear first. I'm gonna go check this ear. So in the adults, you move up and back, and you go in. Any pain? Okay, so when I was going in, I was able to see the auditory canal. There's no any redness or any discharge or anything like that in the tympanic membrane. It looks pretty good. I was able to see the tympanic membrane, which is translucent pearly gray in color. There's no any effusion or bulging of the tympanic membrane. And I was able to look at the cone of light, the umbel, the lateral process of malleolus, and the handle of malleolus, and everything looks normal. So that's all the normal findings, and your ear is good. Okay, moving on to your nose. Looking at your nose, I'm just going to pull a little down. There's no any swelling, there's no any abnormal deviations of the nose, any redness or any discharge that I can see from the nose. I'm just gonna palpate the nose. Okay, any pain? Okay, no pain, no tenderness, again, no any deviation. When I'm palpating this, I'm gonna palpate the sinuses, the maxillary and the frontal sinus, okay?
Okay.
So this is maxillary, no pain, right? This is frontal. Okay, no any tenderness felt, so there's no any signs of infections or anything. No tenderness, okay? So when I'm palpating this, I'm gonna palpate the lymph nodes. So palpate in the preauricular, tonsillar, submandibular, submental, postauricular, posterior cervical, anterior cervical, supraclavicular, and infraclavicular. So no any nodes felt in the lymph nodes, so that's the normal finding. Okay, moving on back to your nose. If there was no mask for this video, we're just not doing it, but if there was no mask, I would light the light into the nasal mucosa and look into the nose with the lights, and I would see the nasal septum, the nasal mucosa, and the nasal turbinates, and that should be pink. No any discharge lesions. We should not see any mass or lesions, anything like that. And with the nasal septum, make sure that it's not deviated on the middle, okay? I forgot to do the autoscope into the eye, look into the eye, so I'm just gonna do that now. So making sure that the dial is correcting the dial so I can see. Okay, so I'm looking into the right eye, just dimming the light, and make sure you dim the light. And oh, let me take this off so that I can see better. Okay, just putting my goggles on for protection for this.
Should look anywhere whenever you do this.
Okay, so make sure you look over the soldier, okay? Look straight over the soldier. Okay, I'm able to see the right red reflex. I'm just gonna come a little closer, okay? So that I can see into your eyes. Okay, good, I can see it, very good. Okay, so I was able to see, I was able to see the optic disc and the optic artery and the veins and the macula and fovea, and there's no any signs of nicking or any hemorrhage in there, okay? So that's normal. And with the nasal, explained it, just putting this back on. Okay, so with the mouth, okay. So if there is no mask, I would check for any lips cracking or bleeding or any dryness in the lips. Into the mouth, I would shine the light to see the mouth, and I would see the buccal mucosa, the tongue in and out. Check for any lesions or any bleeding. Buccal mucosa should be pink. There should be no any excessive redness. Tonsillar should be +1. There should not be any exudates or anything like that, okay? Forgot to do the transillumination of light of your sinuses. I'm just gonna do that. Checking for the light illumination, and you can see really nice illumination of the light in the maxillary, and then the frontal right here. Okay, so good transformation of light, so that's negative for any kind of infection in the sinuses. Going back into the mouth, so buccal mucosa, tongue, look for any lesions. As I already explained about the tonsils, you would see the Stensen's duct, which is on the second upper molar tip, and then the Wharton's duct, which would be below the tongue on the side of the frenulum, okay? So that is what we're looking for in the tongue. I'm deferring the Gag Reflex for this test, which is testing for cranial nerve 9 and 10. And if she doesn't have mask on, I would let her do ah. Can you do ah? Ah. Okay, so when she does that, you would be able to see the rise of the uvula, which is checking cranial nerve 9 and 10 again, and that should be intact. I'm deferring the Smells test, which is cranial nerve 1, and deferring the Snellen's chart, which is cranial nerve 2 for this test. Okay, with the mouth, very much. Protrusion of the tongue. Can you protrude your tongue for me? Okay, and move on side to side. Okay, so she should be able to do it with no any problem, and that's checking for cranial nerve 12, which is intact, or should be intact. Okay, so I'm just gonna check one more cranial nerve, which is shrugging the shoulders, accessory. Okay, push against hand and push against my hand, right there. So that's checking for cranial nerve 11, and that's intact. Okay, moving on to your neck. I'm looking at inspecting the neck. There's no any mass, lesions, any swellings, any pulsation of the carotid artery, or any signs of JVD in the neck. So that's good. I'm gonna palpate it. Again, no any pain, no pain, no tenderness, anything like that in the neck. I'm going back so that I can feel your thyroid gland, okay? So coming on the back, I can feel your cricoid process. And then right here, I can feel the thyroid gland, okay? Go ahead and swallow for me. Okay, when she swallowed, I was able to feel the good up and down movement of the thyroid gland. So that's normal. You should be able to feel it. And so that's normal. Trachea is midline. In the neck, I'm just gonna check for the carotid pulse as well. Okay, make sure you do one at a time to prevent the syncope here. Okay. Good. Okay, so I was able to feel the carotid pulse, which is upstroke and brisk, which is normal. And I'm gonna auscultate the thyroid and the carotid artery here for any bruise. And I'm using the stethoscope bell for that. Okay. Just breathe normally for me. Let's just check for any thyroid bruise. Okay. And the carotid bruise. Okay, so I didn't hear any bruise over the carotid or the thyroid gland, so that's normal finding. Okay, you doing okay? Okay, so moving on to your respiratory system. Do you have any history of chest infection, any pneumonia, anything like that? Okay.
No.
Do you have any trouble taking breathing?
No.
Okay, so that's good. So looking at her chest, her AP diameter is shorter than the lateral diameter, which is expected. She is not using any respiratory, any accessory muscles during the respiration, no any nasal flaring, so that's good with the respiration. Her rate and rhythm is normal. I'm gonna go back. If you can come over here, I'm gonna go back and let's look for chest expansion. So go straight a little bit and go ahead and take a deep breath. Okay, so as you can see, my hand moved at least like 2 centimeters apart during the chest expansion, and that is what we should be able to see when she takes a deep breath, okay? So looking for the, doing the tactile parameters, checking for any consolidation. So every time I touch your chest on the back, just go ahead and say 99.
99, 99, 99, 99.
Okay, so I was able to hear the good equal vibration on both sides when she was saying 99, so that means that there's no any consolidation. If she has consolidation, I would hear the unequal vibration of the sound when she was saying 99, okay? So tactile parameters, I'm gonna do the percussion of your lungs, okay? So going from top. Okay, make sure you get the side of the lungs. Okay, so I was able to hear the good resonance sounds in the lungs, so which is normal if she has the consolidation of the lungs or any air trapped in there, so you would hear either hyperresonance or dull sound, okay, in the lungs. Next is I'm going to check for the costovertebral tenderness, CVA tenderness. That's to check for the kidney. Let me know if you feel any pain or tenderness, okay?
Nope.
Okay.
Nope.
Okay, no any pain or tenderness felt, so CVA is normal. It's normal. Next thing I'm going to do is the auscultation of your lung sounds. Okay, so I want you to take a good, nice breath from in and out from your mouth, okay? So I'm using the diaphragm. Okay, listening in the front for the, so using the ladder technique, doing the same thing on the front. Okay, one more. Okay, good. So I was able to hear the bronchial sound over the clavicle, bronchovascular sound over the trachea, and vesicular sound over the lung tissues, which is normal. Okay, no any adventitious sound, any crackles or rails or anything like that. Okay, next thing I'm gonna do is the egophony test to check again for consolidation. So with that, I want you to say E every time you feel the stethoscope in your back. Okay? Okay.
E, 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 E.
Okay, perfect. So when you were saying E, I was able to hear the good muffled sound of E. If it would change into A, or if the sound was loud and clear, then that would tell us that she has a consolidation in her lungs, like we can see in cases like pneumonia. Okay, so that was normal and good. Respiratory. So moving on to the next system, which is your cardiovascular. I'm just going to ask you again 2 questions. With the cardiovascular, do you have any history of hypertension?
Nope.
Okay. Do you have any history of syncope?
Nope.
No. Okay. And no chest pain?
Nope.
No. Okay. That's good. Okay. Looking at the precordium, just inspecting the precordium. There's no any heaves, striae, or masses, or scars, anything like that in the. Everything is normal, looks normal. I am checking for the costochondritis, just pressing the wall. Any pain?
No.
Okay, so that's negative for the costochondritis. No any pain in the precordium. Palpating for the thrills, okay, with the ball of my hand. Okay, so no any thrills felt when I was palpating, so that's normal. You should not be feeling any thrills in the precordium. Next thing I'm going to palpate is a PMI, which is a point of maximal impulse. It should be on the left 5th intercostal space on the left sternal border, left side 5th intercostal space in the mid-clavicular line. Okay, it should be. So with the females, you just have to make sure that you go lift it up, and breast tissues, and just pull it up. Okay, I'm able to feel it right here, which is good. No any deviation of the lateral movement of the point of maximal impulse, so that's good. If it's on the side, if it's like on the side of the, other than that location, then that would tell us that you have the left ventricular hypertrophy. Okay. Next thing is I'm gonna auscultate your heart sounds for any murmurs or anything like that. First, I'm just auscultating your heart sounds, just hear your normal heart sounds. So the 5 points I'm gonna auscultate is your aortic, pulmonic, herbs, tricuspid, and mitral. Okay, so aortic is in the 2nd intercostal space on the right side. Pulmonic is the left intercostal space on the 2nd intercostal space on the left side. Herbs is the left intercostal space in the 3rd sternal space, left side. And tricuspid on the left side, 4th intercostal space. And the mitral is the 5th intercostal space, mid-clavicular line. So I'm going to hear those points for the heart sound, first using the diaphragm. Okay, good. So I'm switching it into the bell of the stethoscope and listening for any murmurs. Okay, so with the bell, I was able to hear the with the diaphragm. Sorry, I was able to hear the heart sounds. S1, S2 is greater than S1 in the aortic and the pulmonic. S1 is equal to S2 in the herbs point. S1 is greater than S2 in the tricuspid and the mitral wall. So everything is normal. And I did not hear any murmurs or any extra sounds in the 5 points when I was hearing from the bell. So I'm gonna listen for the regurgitations, aortic and the mitral. So for that, I want you to lean forward. I'm using the bell of the stethoscope for the mitral stenosis. So lean forward, take a deep breath and hold for me. Okay, so for aortic, I'm using the diaphragm. Okay, take a deep, so leaning forward, take a deep breath and let it out and hold for me. I'm just gonna quickly listen to the left sternal border. Okay, and the apex of the heart. Okay, thank you. So I did not hear any regurgitation or anything like that in both sides, on the both points and the left sternal border, so that's negative and that's normal. Okay, with the heart. And checking your internal jugular vein pressure, JVD. So just 30, okay? Making sure that the head is elevated up to like 30 degrees. And can you look on the left side for me? I'm just looking for the internal jugular pressure. I can see it right here. And I'm going for the point of oscillation, which is like where the pulse stops, and which is right here. So making sure you put the scale in the perpendicular way on the sternal notch, and you're going from the point of oscillation to measure right here. Okay, so her JVD is 2 centimeters. Usually normal is below 4 centimeters, so hers is normal. If JVD is higher than 4, then that would tell us that she has a hypervolemia, or just in case of like heart failure. So yours is normal, so you can come back. Okay, so going into the peripheral vascular, do you have any problem with swelling of the legs?
Nope.
No, okay. Do you have any problem with pain in the calf muscles when you're walking?
Nope.
Calf, no pain in the walking. Okay, that's good. So I'm just looking at the peripheries. The distribution of the veins looks normal. There's no any hypopigmentation, no any excessive redness or any specific point, no any bruising. I don't see any varicose veins, so that's normal. I'm just gonna pop it. Okay, skin feels warm bilaterally, and yep, no any varicose veins. I'm just gonna check for any capillary fills. It fills right away, which is less than 3 minutes, so that's normal. Same thing in the legs. Okay, that's good. I'm checking for the pulses now. Checking starting from here. I'm going to check for the brachial. Okay, radial. Okay, I'm deferring the femoral pulse for this video. I'm checking the popliteal pulse. Okay. Dorsalis pedis. Okay, and the dorsalis pedis and posterior tibialis. Okay. Okay, I was able to feel the pulses bilaterally +2, which is normal. There's no any pounding pulses or anything like that, so that's good. Okay, so moving on to your abdomen. Okay, do you have any problem with your stool changes like diarrhea or constipation?
No.
Okay, do you have any pain in the stomach right now?
No.
Okay, that's good. Okay, I want you to lay down straight. I'm just gonna put this down, okay? Okay, sorry. Okay, make sure you flex it, which is already doing. Make sure you're flexing your knee, so to check the abdomen. Okay, so I'm inspecting the abdomen. There's no any mass or lesions or any peristalsis movement, any pulsation, anything like that in the abdomen. Okay, so I'm gonna auscultate the abdomen before I do anything. Okay. Okay, I'm able to hear the good bowel movement in the right lower quadrant. So which means that her bowel sounds on all the quadrants are active. If there's no any bowel sound that we can hear in the right lower quadrant, then we would have listened to all the bowel sounds on all the quadrants. So for now, it's normal, okay? So next thing I'm going to do is the percussion. So with the percussion, just going to percuss right here in the stomach. Okay, so she has a good tympanic sound in the abdomen, which is normal. There's no any dullness, which is a lot that she has a masses in her abdomen. When I'm percussing, I'm just gonna do the liver span measurement as well. So I need these two things. So I'm going from tympanic of the abdomen on the edges right here. Okay, right here I can hear the dullness. Okay, from the top, I'm going from tympanic to dullness. Okay, right here I can hear the dullness right here. Okay, so measuring it. Okay, so you can see that it's 8 centimeter. Usually normal is 6 to 12 centimeters, so hers is normal. Okay, so percussion. Now I'm gonna do the light palpation, starting with the light one. So let me know if you feel any pain or tenderness. Just the light. I don't feel any masses, any abnormal growth, or any tenderness, or any the bladder. I don't feel bladder, so there's no any bladder abnormalities. Okay, so I'm doing the deep palpation now. Let me know if you feel any pain or anything like that. Any pain? Again, I don't feel any mass, any lesions, any growth, abnormal growth, or the bladder. I don't feel bladder, so that's normal. Okay, so I'm gonna try to feel the liver. Try to feel the liver, so go ahead and take a deep breath for me. Okay, when she was taking the deep breath, I was able to feel the liver, and that's normal. That's using the hooking technique. I'm going to try to feel the kidney here. Okay, on the other side. Okay, I'm not able to feel the kidney. You're not supposed to feel the kidney unless the patient is very, very thin. Sometimes you feel the right kidney because of its anatomical position. Okay, let me see if I can. Okay, I'm going on this side. Okay, so I'm here to feel, trying to feel the spleen. So again, using the hooking technique, going in. Take a deep breath for me. Okay, so I'm not able to feel the spleen, which is normal. You're not supposed to feel the spleen. I'm sorry, I'm going to dip. Okay, so when I'm here, I'm gonna do the, can we switch the side? Yep. From the right side, sorry. Okay, so from here, I'm gonna do the Murphy sign. And the Murphy sign, I'm going in deep. Any pain? Anything like that, take a deep breath. Okay, so no any pain. That's negative for the Murphy sign, which tells us that she has no any gallbladder infection. Next is doing the Rofskin sign, going on the left side, pressing deep, take a deep breath. Any pain? Okay, no pain on the right lower quadrant, no pain. So that's negative for the negative Rofskin sign, which tells us that she has no appendicitis, signs of appendicitis. Okay, next is the Bloomberg sign, which is also known as the rebound tenderness. I'm gonna deeply palpate and take a deep breath for me. Any pain when I do this? Okay, negative for Bloomberg sign. That's negative for the appendicitis. If she feels pain, or when I let it go, or if she feels pain when she's doing the deep breathing, so that tells us that she is positive for appendicitis. Okay, next two tests I'm going to do is the Obturator and the Swell sign. Go ahead and make your leg straight. Okay, push, bend this knee and push against my hand. Okay, any pain on the right lower quadrant? No pain, so that's negative for the Swell sign. So that tells us that she's negative for appendicitis. And the next is the Obturator sign. So I'm just going to lift this leg in and out. Any pain on the right lower quadrant? Okay, that's negative for the Swell sign, and that's negative for the signs of any appendicitis. So that's the abdomen. Okay, so when you're laying down here, I'm just going to do a few more tests. Okay, so that's the next is to check the meningeal irritation. the first thing I'm going to do is the Bruskin sign. Can you touch your chin to the chest? Any pain in the back or lower anywhere?
Nope.
Okay, so that's negative for the Bruskin sign. If she feels pain in the back, or if she lifts her legs, then that would be positive for the Bruskin sign, okay? Next is the Kernic sign. Can you lift this leg up? Any pain on the back? Okay, so that's negative for the Kernic sign. If when she was lifting this leg, if she lifts her head unconsciously, or if she left the other leg, then that would be positive for the Kernic sign. That tells us that she has a meningeal irritation, and also the pain in the back when she's doing that. Okay, so when you're laying down, I'm going to do the microfilament test to check for the diabetic foot. Okay, and this is the microfilament, and you would be able to feel the pinch like this. Okay, so make sure that it's bent so that she can feel it. Okay, so let me know where you feel it.
On my big toe.
Okay, right or left?
Side, right side.
Okay.
You can feel it. You can feel it. You can feel it. You can feel it.
Okay, good job. Okay, we're doing the same thing on here. Okay, let me know where it is.
On my big toe on the left foot.
Okay, can you feel it?
I can feel it. I can feel it. I can feel it. I can feel it.
Okay, so the sensation on the bilateral foot is normal for the microfilament. The next thing I'm going to do is the vibration of the big toe to check for your sensation, bone sensation. So I'm just going to vibrate, put it right here. Can you feel the vibration? Let me know when it stops.
It stopped.
Okay. And the vibration on the other leg.
I can feel it on my left foot.
Okay. So she's able to feel it, so that's normal for the big toe vibration. Now next I'm going to do is the proprioception. Okay. So I'm just going to move your finger, the toe, I'm sorry. I'm going to move the toe, big toe, and let me know if I'm going up or down.
Okay. Down. Up. Up. Down.
Perfect. So that's normal. Okay, when I'm here, I'm also going to do the leg raise test. Okay, if you can raise this leg straight up as much as you can and let it down. Any pain in your back or anywhere?
No.
Okay, so that's leg raise test is normal. If she feels pain in the same leg, ipsilateral pain, that would be positive for sciatica. If she felt pain on the contralateral side, which is the opposite side, that would be positive for the herniation disc. Okay. Can you move your hip adduction and abduction, like going in and going out? Okay, that's good. And the other, okay, up and down would be, oh wow, okay. So range of motion for the hip is normal, and push my leg against, okay? Again, this one, and here, down, down, okay. So range of motion is normal, and strength is 5 out of 5, okay? Bend your knees, okay, all the way, and go out. Okay, so that's the range of motion of the knee, and that's normal. Okay, I'm deferring the pelvic exam for this test, just for the video. And maybe, okay, perfect. I will have you sit down now. Okay, you're doing okay? Sorry.
No, you're good. You're doing
So,
great.
okay, I am doing the musculoskeletal. So do you have, with the musculoskeletal, do you have any problem walking? Do you have any joint problems, swelling or anything?
No.
Okay, and do you have any problem with movement when you're moving? No, okay. No any movement problem. Okay, that's good. So looking at the shoulder, there's no any redness and your abnormal mass or growth of the bones, okay? So I'm just gonna palpate. Any pain? No pain, no tenderness, anything like that, so that's normal. I'm gonna do the few tests with the shoulder to check for the rotator cuff tear. The first thing I'm gonna do is the shoulder drop arm test. I want you to let it go all the way up and bring it slowly down. Slow. Okay, any pain, anything? Okay, so that is to check for the rotator cuff tear, and the shoulder drop arm test is negative. If you are not able to bring it very slowly, if you have pain in the shoulder, that will be positive for the rotator cuff tear. Next is the near test. For the near test, I want you to straighten your hand, externally rotate. I'm going to press down into scapula and put it all the way down up. Any pain? Okay, so that's negative for the near test. Again, negative for the rotator cuff tear. Okay, next is the Hawkins test. For Hawkins test, I'm going to go here and venture in here, externally rotate, and then pushing down. Any pain? Anywhere? Okay. Okay, so that's negative for the Hawkins test, and again negative for the rotator cuff tear. Okay. Moving on to your elbow. Okay, I'm looking at the elbow. There's no any tender pain. There's no any redness, no any swellings, abnormal mass or growth of the bones. Okay, so I'm just palpating the elbow. Okay, that looks normal. No any tenderness. Can you move in, out? Okay, against my hand, against my hand. Okay, range of motion is normal, and strength is 5 out of 5. Okay, against my shoulder. Okay, and for the neck, I don't think I did it. Range of motion down, here, up, and then all the way. Okay, for neck, range of motion is normal, strength is 5 out of 5. For the shoulder, go up, down, internal rotation, external rotation, and hug yourself. Okay, range of motion for shoulder is normal, and again I check the strength, it's a 5 out of 5. Please, I'm looking at your wrist, your fingers. There's no any redness, there's no any swelling, any abnormal mass or any growth of the bones, so that's good. Palpating. Okay, so there's no any tenderness. Again, I don't feel any masses or any abnormal growth of the bones. Okay, so doing some tests. First is the checking for the scaphoid tenderness. So if you can extend your hand, I'm just looking for the scaphoid tenderness right here. Okay, I don't feel any tenderness, so that's negative for the scaphoid tenderness. Okay, next is the wrist exam. The first thing I want to do is the Tactile sign to check for the carpal tunnel syndrome. Okay, so I'm just gonna tap. Any pain or any numbness, tingling, anything. Okay, that's negative for the Tactile sign, just negative for the carpal tunnel syndrome. The next is the Finkelstein sign. If you can grab your thumb, and any pain when I'm doing that? Any pain when I'm feeling the pressure? Okay, so no pain when doing that, so that's negative for the Tactile sign, and negative for carpal tunnel syndrome. If she has pain, then that will be positive. Okay. Next is the phalanx sign. Any pain or tenderness, numbness, tingling? No. You would do that for 1 minute, but for the sake of the video time, I'm not doing it for 1 minute. So that's negative for the phalanx sign. No any signs of carpal tunnel syndrome. So that's everything is normal with the wrist. Okay. And for the range of motion, I want you to grab my finger. Okay, that's good. Adduction, abduction. Okay, open your close. Adduction, abduction, and then don't let me close. Okay, don't let me open. Okay, and wrist movement. Okay, range of on and push, pull. Okay, so strength is 5 out of 5, and range of motion is normal. So that's the normal. Okay, so moving on to your knees. I'm looking at your knees. So in the normal circumstances, you would not see any swellings if it was not here. No swellings, no any tenderness, no any pain, excessive redness, mass or lesions. And when you're palpating, no any pain, no tenderness, no any mass or lesions again. Okay, so I'm going to do some maneuvers with the knee to check for effusion and the meniscal tears. Okay, I'm going to lay down and straight, leg straight. Scaphoid. Okay, so with the knee, first I'm checking is the Bloomberg test. Okay, so making sure you're milking all the way fluids in if there's any, and then checking for any fluids right here. So I don't feel any fluids right now, no tenderness, nothing. So that's negative for the Bloomberg sign. So no any signs of knee effusion. You would do the same on the other knee. Next is the Acl and Pcl tear. Let me do the meniscal tear first. McMurray sign for the meniscal tear. So for that, you grab the kneecap and you go in, and then internal rotation. Okay, one more time, external rotation. Okay, so I didn't feel any crepitus or any popping or locking signs of the locking of the patella bone. So that's negative for the McMurray sign, no meniscal tear. Okay, so I want you to bend your knee. Just sitting here just for the to stable it, and doing the anterior and posterior drawer. Anterior drawer, any pain, check for the ACL, anterior crucial ligament, and then pushing it. Any pain, nope. Tenderness, no. So that's the posterior drawer sign. So that's checking for the PCL, posterior crucial ligament. Okay. Next is MCL and the LCL tear, and varus and valgus test for that. So for varus, you're externally rotating and going in, pushing it in. Any pain?
Nope.
No? Okay, so that's negative for the varus sign. So no MCL tear. And for LCL, in, you're going out. In, you're going out. Okay, so external rotation and you're going out. Okay? Any pain?
Nope.
Okay, so no any pain. So that's negative for the, again, valgus test. Checking for the MCL. So MCL and LCL. Checking for LCL. So medial lateral ligament and the MCL, LCL is the lateral collateral ligament. So that's negative. So everything looks good. Okay. Checking for range of motion. Can you like rotate here? Yep, there, and then your toes, curl it up, out, movement. Okay, against my hand, both sides against my hand, pressing here. Okay, so that's good. Okay, you can go ahead and sit down. With the toes and the foot, I don't see any swellings, any redness, or any abdominal mass or growth. I'm palpating. Okay, again, no, nothing I can feel, no tenderness, no abdominal mass or growth, so that's normal. And your range of motion was normal, and your strength is 5 out of 5 in the legs, so that's good. Okay. Next thing, I'm moving on to your musculoskeletal, neuro, okay? With the neuro, do you have any problem with remembering things, any history of forgetting, dementia, anything? Do you have any problem with balancing when you're walking?
No.
Okay, that's good. Can you touch from heel to shin, like that, right there? Okay, so checking for cerebral function, and that's normal. Heel to shin is normal. Next is I'm checking for the tendon reflexes. Here. Okay, so first thing I'm going to check is the radial brachialis. So I'm going to let it go. Okay, I'm feeling the ligament right here. Okay, so that was a good reflex. So I can see the supination of the hand and the contraction of the forearms. Okay, so next is the biceps muscles, and you feel the ligament right here. Okay, so relax, and okay, so the contraction of the biceps muscles and the flexion of the forearm. Okay, so checking for the if you can come back right here. Checking for the triceps muscles, triceps reflexes. So you go feel the ligament right here. Make sure it's okay, loose, and okay. So I was able to see the contraction of the triceps muscles and the extension of the forearm. So that's normal. Next is the popliteal. So I'm sorry, the patella bone going right below there, which is right here. Okay, so right there I'm able to see the contraction of the quadriceps muscles and the extension of the foot. Okay, and next is the Achilles, which is also known as the ankle reflex. For that, I'm feeling the tendon on the back, just hitting right there. One more time. Okay, so I'm able to see the plantar flexion of the foot and contraction of the quadriceps muscles, which is normal. So for all the reflexes are normal. With the neuro. Okay, so can we do the rapid movement of the eyes? We're checking for the rapid movement for cerebellar function. Okay, that's good. That's normal. That's fine. Touch your fingers for me. Okay, touch your nose and my finger. Again, checking for the cerebellar function, and that's intact and normal. During the sharp and dull test to check for sensation. Okay, so this is going to be sharp, this is going to be dull. Okay, close your eyes for me and let me know what you can feel.
Sharp, dull, sharp, dull.
Okay,
sharp, dull, sharp, dull.
perfect. Okay, so now I'm going to do the 2-point and 1-point test. Okay, so for that, this is going to be 2-point.
Okay.
This is going to be 1 point.
Okay.
Okay, close your eyes for me.
2, 1, 2, 1, 2, 1, 1, 2, 1.
Okay, perfect. So the sharp and dull and the 2-point and 1-point sensations are normal, so that is what is expected. The sensations are normal, okay? Next thing I'm doing is having you walk, okay? So, okay, I want you to walk straight and come back. I'm just looking at the gait and the coordination, and that looks pretty normal. Very good. Okay, next thing I'm doing is a Bloomberg test. For that, I want you to close your eyes and just looking for any swinging or any balance problem, but she does not have any, so her Bloomberg test is negative. Checking for cerebral function for that. And next is the Bloomberg sign. If you can turn back and lift one foot for me. Okay, there's no any swing of anything. Abnormal outgrowth of the hip bones on the other side. Okay, so we don't see any abnormal swinging of the hip bone, so that's normal. Okay, look front and look back. I'm sorry. Checking at the spine bone. No any tenderness. I feel pretty in the middle. Any pain? No. You can bend and then up and then back. Okay. Anything you feel? No pain. Okay. The spine range of motion is normal. Okay. And anything else? Okay, you can have a sit. You're standing. Great. Motion. Okay. If you can, I'm sorry. If you can come out and just do like swinging of the legs, like in, out. Just checking for hip bone range of motion and in and out. Okay. Okay, so again, the bones, the hip bone range of motion is normal, and there's no any pain or tenderness, anything like that. Okay, you can go ahead and sit up. Okay, you doing okay?
Mm-hmm.
Okay, so I think pretty much it. Thank you for your time, and I hope to see you next time. Okay.
Thank you
for
very
your
much.
time. Okay, I'm just gonna wash my hand, and thank you.